Hello, dear aspirants. Welcome you all to the Master Nursing classes. Here we are discussing the most important question for our upcoming RRB exams, Norcet 8 exams, and especially for our CRE EACC exams and CRE SNO exams. Many students they will prefer the medical surgical nursing. They will prepare for the fundamental of the nursing and OBG nursing as a very important concept, and they will neglect the pharmacology. So in last many previous exams, there are applied questions from the pharmacology that is striking and deciding the ranks of the students. So the master nursing classes and your master is here to discuss those very important and a limited syllabus that is striking repeatedly in our upcoming exams in detail, in clear, with perfectness. So without wasting the time, we will start the today's class. If anyone didn't watch the yesterday's class, that is the wildfire 5 class. So that is also very importantly discussed on the pharmacology. Okay, this is the second class over the pharmacology. So we'll start the today's class. Before going to the main class, here is an important announcement for you all. Exposed to the same situation of the CRE exams. But I am telling, if you are first time facing the CRE exams, that is with the sections. What is sections? Where the 100 marks or 100 questions divided into the 20 questions, 20 questions, and 20 questions, and 20 questions in 5 sections. For each sections, they are allotting the time of the 18 minutes. Here, not only knowledge, the very importantly, time management, anxiety management, and reducing the mistakes also will going to equally going to decide your rank. In order to get the same situation practices, the master nursing classes launched the CRE same pattern test series, which is already live in our app. So all you people have to download the master nursing classes app from your Google Play Store, and link also given in the description box and link also given in the comment box also. So from there, you people can join to our official Telegram group and our official WhatsApp group and our official app. Okay. So very importantly, don't miss the chance. This is the golden chance to decide your rank. Bacho, studying and having knowledge is one part, and practicing and getting rank is another part. So don't miss the practice. Start your practice. Give daily one live test. Okay. So this is the 100 question totals. In this one, 70 is nursing questions, 25 is non-nursing questions with 5 sections of the 20 questions and 18 minutes. This is the scenario what you people going to face in the main exam. This particular scenario only we are making the students to practice to reduce their anxiety, to control their negative marks, and to get the best rank in the upcoming CRE exams. So I'm informing you also to download the app and practice the best quality test for the better rank. Okay, so we'll start our today's class. So first question of the today's class is here. This is the most important and 10 star question you people have to consider. What is this? This is the question from the Parkinsonism, the pharmacological content of the Parkinsonism. So let me deal this question with concept that is you people don't forget and never ever forget in your life. Okay, so the question is like this: what is the role of the carbidopa when administered with the levodopa in the treatment of the Parkinsonism disease? Yes, option is the carbidopa increases the central nervous system penetration of the levodopa. Option A, what it is telling, carbidopa, it is helping to increase the penetration of the levodopa. So option A, it is telling. We will see how much it is correct. So then option B is the carbidopa prevents the peripheral conversion of the levodopa, okay, to dopamine. What happened here? Carbidopa, what it is doing, it preventing the peripheral conversion of the levodopa to dopamine. Yes, is this correct? Let us discuss in the rationale. Okay, carbidopa acts as a dopamine receptor agonist. Never ever. Then option D is there is the carbidopa decreases the metabolism of the levodopa in the brain. It increases the metabolism. This is also I am eliminating. Okay, carbidopa will not decreases the metabolism of the levodopa in the brain. Actually, carbidopa increases the metabolism of the levodopa in the brain. So let me clear with the concept. But consider this one is your blood-brain barrier. What it is? It is your blood-brain barrier, which is made up of the astrocytes. Okay, which is made up of the astrocytes. So we are having the different glial cells in our brain. So among all glial cells, which glial cell makes your blood-brain barrier? That is the astrocyte, which makes your blood-brain barrier. So one important questions. Okay. So consider this is the blood-brain barrier means here will be your blood and here will be your brain. Right? Here I am giving the levodopa tablet where it will coming into the our blood. Okay. Where it will coming into the our blood. So when the levodopa comes in the blood, it will get converts into the dopa. This dopa is having the ability to cross this blood-brain barrier. It can cross the blood-brain barrier very easily. But what happened is the levodopa, which is get converted into the dopa, this dopa it will get converts into the dopamine with the help of the vitamin B6 and with the help of the peripheral decarboxylase enzyme. Yes. So I am giving the levodopa plus carbidopa. Right? If I am giving both this levodopa and carbidopa, means this carbidopa holds the function of this peripheral decarboxylase and vitamin B6. It will don't allow the this dopa to get converted into the dopamine. Means it is preventing peripheral conversion of the levodopa to dopamine. So levodopa is get converted into dopa and dopa is getting converted into the dopamine in the presence of the peripheral decarboxylase enzyme and vitamin B6. So this is the reason many times the question asked that which vitamin is not recommended along with the levodopa along with the treatment of the our Parkinsonism. Means vitamin B6 is not recommended along with the treatment of the Parkinsonism. Bacho, very importantly, all you people have to know because so this levodopa increase converting the dopa to dopamine in the blood only. So this dopamine is increasing in the blood only. So I don't want the dopamine to get increase in the blood. I want the dopamine to get increase in the brain. Okay. Why? Because so what is the Parkinsonism? Parkinsonism is the yes deficiency of the dopamine in the brain. Okay. Where the dopamine decreasing in the Parkinsonism? Dopamine decreasing in brain. Okay. So this may leads to the Parkinsonism. Right? This may leads to the Parkinsonism. Okay. So I don't want the dopamine to get increase in the blood. I want the dopamine to get increase in the brain. So I am giving the this carbidopa. This carbidopa, what it is doing? It is preventing the peripheral conversion of the this dopa to dopamine and it increasing the amount of the dopa. This dopa is having the ability to cross the blood-brain barrier and this dopa it will comes to the brain now. So in the brain, with the help of the central decarboxylase enzyme. Okay, so this central decarboxylase enzyme is converting the dopa to dopamine here. So now the dopamine is get increased in the blood. So in the Parkinsonism, dopamine get decreased in the blood. So we are giving the treatment of the that is the levodopa plus carbidopa, which increases the blood in the yes, which increases the dopamine in the brain. So this is the reason levodopa is never ever given alone. Along with the levodopa, always give the carbidopa, so which helps to prevent the peripheral conversion of the levodopa to dopamine. Hope the concept is clear. So option B goes to the correct answer. That is the carbidopa prevents the peripheral conversion of the levodopa into the dopamine. So this is the correct answer. And if the examiner want to ask the question from this particular concept, he will ask this question only with the same option. Consider this one. Okay. So very important questions for you all. Why we need to give the levodopa and carbidopa together? Because the carbidopa helps to prevent peripheral conversion of the levodopa to the dopamine, and it increases the availability of the dopamine in the brain. So that is the reason levodopa and carbidopa will be given together. Very, very importantly, all people have to understand here. So here is the next question. What is the next simple question and important question? So which of the following drug is contraindicated in the glaucoma? So what is glaucoma first of all? Glaucoma is a simple thing where there is increased intraocular pressure because of increased aqueous humor, fluid in the eye. So it is increasing because of the closed angle or overproduction. Why the aqueous humor is increasing? It may increasing because of the angle is closed and overproduction. So there are two important reasons. So what is the angle? Let me deal with that. Okay. So just a second, please. What is the angle? Let me take a new slide. It will help to all. Okay. So this is the our beautiful cornea. Okay. So here is the eyeball. That is the outer layer. And here we are having the very, very beautiful eye. Okay. So this is our iris. This is our iris and this is our cornea. Right. So in between the iris and cornea, here is the angle. Okay. So in this angle, here there is one whole like mesh like structure. We call this one as a trabecular meshwork. Okay. So from here, the aqueous humor which produces and it will comes and from here it will get absorbs. When this particular iris muscles will get constrict, iris muscles will get constrict means the pupils will get dilate. Okay. So this iris muscle get constrict means the pupils will get dilate, and if the pupils will get dilate and iris muscle constrict, it means the angle will get close here. The angle will get close here means this aqueous humor fluid it will not drain and it will keeps on increasing here. So because of that increased aqueous humor fluid in the eye, so intraocular pressure will get increases. So what is the normal intraocular pressure? Intraocular pressure normal is the that is 10 to 21 mm of Hg. Okay, very very importantly, all you people have to know. So now in the treatment, I don't want the angle to become close. Means I want to angle to become open only. So I don't want the pupils to get dilated. So I will not give the any anticholinergic drugs which dilates the pupil. So don't dilate. Don't dilate. Okay. So don't dilate means don't give anticholinergics. Don't give anticholinergics. So what all are the anticholinergics drugs? Mostly examiner will ask. That is the very very importantly atropine sulfate, which is contraindicated in the glaucoma, scopolamine. Okay, this is also contraindicated in the glaucoma. Very very importantly, why the anticholinergics are contraindicated in the glaucoma? Why? Because the anticholinergics dilates the pupils. So pupil dilation will close the angle. So angle is closed means again the IOP will get increases. Okay, this is the reason our atropine and scopolamine is contraindicated in the glaucoma. This question may strike in the exams, but a very very important concept. Okay, so then next option is that is so question is like this: which of the drugs are contraindicated in the glaucoma? So anticholinergics is contraindicated in the glaucoma, like atropine, which is contraindicated in the glaucoma. Then what else? Along with the atropine, scopolamine contraindicated in the glaucoma. Okay, so in eye drops forms, so we are using the tropicamide. So this tropicamide also contraindicated in the glaucoma, atropine also contraindicated in the glaucoma, and scopolamine also contraindicated in the glaucoma because which closes the angle. So this is contraindicated in the glaucoma. Then comes to the beta blockers. So beta blockers we will give here. Okay, why? Because the beta blockers will keeps the angle become open. Okay, so beta blockers it will constrict the pupils, and beta blockers it will keeps the pupils to it will keep the angle open only. So beta blockers we can use in the glaucoma. So which beta blocker used in the glaucoma? That is the preferred one is the timolol. Okay, timolol is the beta blockers that is used in the pharmacology. Okay, so that is the used in the glaucoma. Okay, for important pharmacological management of the glaucoma, we can use the beta blockers. That is the timolol. It keeps the our eye angle open. So then comes to the alpha agonist. This is also same. It keeps the angle open. So it is also used in the glaucoma. So then comes to the carbonic anhydrase inhibitors. Here we are having one drugs that is the acetazolamide. Okay, acetazolamide. So this acetazolamide, what it will do? It will reduces the production of the aqueous humor. Okay, what I told the two reason of the glaucoma. One is angle closure, which increases the IOP, which causes the glaucoma. Another one is the overproduction, which increases the IOP and which causes the glaucoma. Right. So here we are giving the acetazolamide, so which decreases the production of the aqueous humor. Okay, so production will get decreases means IOP will get decreases and glaucoma will get treated. So acetazolamide we are using as a primary drug of the treatment of the our glaucoma. Very importantly, acetazolamide also decreases the production of the CSF also. So this is also used as a drug of choice in the mountain sickness. Okay, so drug of choice in the mountain sickness is the again acetazolamide. Very importantly, keeps in your mind, right? So we'll start the next question here. Here is the next question. Yes. A 30-year-old woman presents to the emergency department 6 hours after the intentional overdose of the paracetamol, that is the acetaminophen, and her initial symptoms includes nausea and vomiting. And what is the first line antidote for the paracetamol poisoning? Simple. The question is asking about the first line antidote for the paracetamol poisoning. Okay. So what happened here? 30-year-old woman, she is intentionally taken the overdose of the paracetamol. So now, which one we can use as a first line antidote for the paracetamol? Option A is the N-acetylcysteine, B is the activated charcoal, C is the flumazenil, then option D is the naloxone. So naloxone, it is used as the antidote in the yes, opioid poisoning. Okay. So then flumazenil, it is used in the antidote in the yes. Which situations we can use the flumazenil as the antidote? Yes, that is the benzodiazepine. Correct. Benzodiazepines poisoning. So we can use the flumazenil. Activated charcoal is the universal antidote. We can use it in the many of the poisonings. Okay. So then comes to the important, that is the paracetamol poisoning. Antidote is the N-acetylcysteine. What is the safest dose of the paracetamol? So 3 gram per day is the safe dose of the paracetamol. Means paracetamol it will comes in the 500 mg mainly and 650 mg also there. So 500 mg usually we will use. So 6 tablets is safe per day. So more than 3 grams or more than 6 tablets of the 500 mg if the patient is taken means, so that may damage us the liver. Okay, so which organ will be get damaged in the paracetamol overdose or the paracetamol toxicity? So liver is the primary organ which damages in the paracetamol overdose or the paracetamol toxicity. It will be asked in your exams very importantly. Okay, so here is the next question. That is the very important and simple question. Which of the following is a common pulmonary side effect of the amiodarone? So what is the amiodarone? Amiodarone is the drug. Okay, so here it will helps to terminate the arrhythmias. Okay, it is used in the treatment of the arrhythmias. That is the amiodarone. So the specific side effects of the amiodarone will be asked here. That is related to the pulmonary side effects. Yes, option A is the pulmonary fibrosis. Option B is the acute bronchitis. Option C is the asthma exacerbation, and option D is the pleural effusion. So here the amiodarone is having the two dangerous side effects. Okay, two dangerous side effects. One is one is it makes the fibrosis of the lungs and it damages the thyroid gland. Okay, remember this image. Okay, so it is anti-thyroid, very dangerous. It will damage the thyroid gland and it helps. It is having the side effect of the pulmonary fibrosis also. That is the pulmonary fibrosis is the correct answer. Okay, this will strikes in your exams. But you remember which of the following is the common side effect of the amiodarone. That is the pulmonary fibrosis and damage to the thyroid gland also there. And this amiodarone, okay, it will get deposits in our skin, so which makes the person to get blue in color. So that is the blue man syndrome is associated with which drug? That is the amiodarone. So high blue man syndrome happens in the amiodarone because this amiodarone is the fat soluble. Okay, so it will get deposits in the fat. Okay, so underneath our fatty tissue. Okay, so it makes the person to looks like blue. So blue man syndrome seen in which particular condition? That is in the person who is taking the amiodarone for long duration. Okay, person who is taking the amiodarone for the long duration. So which particular situation will be faced? That is the blue man syndrome. Very very importantly, it will strikes in your upcoming exams. Okay, so here is the next question. So what is the next question here? So which of the following is factor increases the risk of the hypoglycemia in patient who is receiving the amphotericin B? So what is the amphotericin B? Amphotericin B is a anti-fungal drug. Okay, amphotericin B is the anti-fungal drugs. Means it helps to destroy the funguses. Okay, like in the COVID, due to the overdose of the steroids, there is mucormycosis. Means what is the mycosis? Mycosis means here is the fungal infections. So over the face there are the dark necrotic tissue formation because of the mucormycosis. There also drug of choice used as a amphotericin B. And remember one more important question: the drug of choice for the Kala Azar. The drug of choice for the Kala Azar is the amphotericin B. Amphotericin B is the antifungal drug. Very very importantly, when you will be giving the amphotericin B, so it may cause the hypoglycemia. Okay, it may cause the hypoglycemia. So always amphotericin B will be given with the dextrose 5%. Okay, so in which solution amphotericin B will be diluted? The amphotericin B will be diluted in the dextrose 5%. Very very importantly, it will strikes in our exams. Okay, very very important. So then comes to the question, that is the which of the following is the risk factor? Factor which increases the risk of the hypoglycemia. So in the amphotericin B patient, that is the option A is the concurrent use of the hypoglycemic agent. Yes. So this is makes the person to get hypoglycemic. What happens here? You are using the amphotericin B also. Okay. So concurrently you are giving some hypoglycemic agent like insulin or metformin, like glyburide, glimepiride. Okay, these medications you are giving. Along with this, you are giving the amphotericin B also. Means concurrent use of the hypoglycemic agents with amphotericin B, it increases the risk of the hypoglycemia. Yes, the option A word is correct here. Okay, so the option A word is correct here. That is the concurrent use of the oral hypoglycemic agent increases the risk of the hypoglycemia. Then comes to the option B, that is the high dose of the amphotericin B. Yes, so high dose of the amphotericin B. What happens here? The amphotericin B, how it causes the hypoglycemia? It prevents the gluconeogenesis. It prevents the gluconeogenesis and glycogenolysis also. It will prevent. So there is no glycogenolysis, means the glycogen will not get converted into the glucose, and there is no blood glucose increase in the blood glucose level. So amphotericin B, how it causes the hypoglycemia? By preventing the gluconeogenesis also and by preventing the glycogenolysis also. Okay, so already there is a risk of the hypoglycemia in the amphotericin B taking patient. Okay, so what option B is telling? The high dose of the amphotericin B we are giving means, so mostly it will cause the hypoglycemia. This is also, yes, high dose of the amphotericin B also, it completely blocks the gluconeogenesis, it completely blocks the glycogenolysis, and it increases the risk of the hypoglycemia, right? So then option C is telling that the impaired renal function. But amphotericin B, it will completely eliminated by the kidney. Okay, so if there is damage to the kidney or impaired renal function, the amphotericin B will again increases in the blood. Amphotericin B will again increases in the blood, means again it will blocks the gluconeogenesis and glycogenolysis. Again, there is no glucose in the blood, so again it increases the risk of the hypoglycemia. So these questions may strikes here, or the components what I have discussed here, it may strikes in your upcoming exams. Okay, so because of this, as a nursing officer, we have to assess the renal function test, that is the RFT, before giving the amphotericin B, and before giving the potassium also assessment of the kidney function is most important. Okay, why? Because it will completely eliminates by the kidney. Okay, right? Is that clear? Then correct answer for this question will be the all the above will be the correct answer. So remember, amphotericin is the antifungal drug used in the treatment of the mucormycosis, used in the treatment of the, yes, Kala Azar. The drug of choice for the Kala Azar is the our amphotericin B. Important. Then the amphotericin B blocks the glycogenolysis, blocks the gluconeogenesis, and which causes the hypoglycemia. Okay. So because of this, while giving the amphotericin B to the patient, the prepared solution of the dilution is the dextrose 5%. Is very, very important. Okay. So hope the concept is clear over the amphotericin B. And here is the next question. Right. The question is very simple. That is the a 65-year-old patient on long-term warfarin therapy presents with the blue discoloration of the feet, particularly noticed on the toes. The patient is otherwise stable and no obvious signs of the infection and trauma. There is no trauma and there is no sign of the infection. Just the patient who is on the warfarin therapy. Okay, so his toys are get discolored to the blue color here. Okay, so there is no obvious sign of the infection. There is no obvious sign of the trauma. And what is the most likely cause of this condition? Option A, that is the warfarin induced skin necrosis. This is the very rare condition. Okay, so if the necrosis will be there, means it will not get converted into the blue, it will get converted into the brown or black. Brown or black. Because of the warfarin, if that particular tissue in one particular area is get black in color or the brown in color, means that is the warfarin induced necrosis. So here they have not given in the question body. So your answer will be not this one. So I'm eliminating option A. So then I will coming to the deep vein thrombosis. If they want to ask the question from the deep vein thrombosis, they would have given some sign of the some sign of the inflammation here. That is the cough, muscle pain, and cough muscle redness, and cough muscle tenderness. Okay, so there is no any obvious signs of this particular DVT here. So I am eliminating this one also. Then peripheral arterial disease, there is blue discoloration will be there. But when we are giving the warfarin therapy, it will not cause the peripheral arterial disease. So what warfarin will do? It will form the microemboli from the warfarin therapy. Okay. Sir, what you are talking, sir? Warfarin is the anticoagulant drug. How it forms the emboli? Bachcho, warfarin having the potentiality to cause small and very small emboli. Okay, so that is what we call the microemboli. Even it is anticoagulant drug. In the long duration treatment, it may causes the micro means small emboli. Okay, it may obstruct the obstruction of the toes of the foot. So that is what we call as the blue foot syndrome. Okay, or we can say the blue feet syndrome. It will be seen in patient who is taking the warfarin for the long therapy. Very, very important questions again here. Okay. So the next question is here. Question looks very long, but this one question, it will help you to solve the many other 10 questions on this particular situation here. Okay. So the question is very simple. A 7-year-old child is present with emergency department with the vomiting, lethargy, and altered mental status. The child has recently received the influenza like recently having the history of the influenza like illness and was treated with aspirin. Okay, so child is having the influenza like illness, means influenza is the, okay, this is the viral disease. Along with viral disease, they have given the aspirin. But so whenever the patient is having the viral disease, if you are giving the aspirin, means it will damage us to our liver and it will damage to our brain. Okay, it will permanently damage to the liver, it will damage to our brain, and it is very dangerous. So when there is damage to the brain, there is altered mental status will be there. Okay, and so there is hepatic dysfunction will be there, and increased intraocular pressure will be there because of the damage to the brain here. So what we call this situation as? Yes. So giving the aspirin in viral diseases which damages to the liver and brain, we call this one as the race syndrome. Very, very importantly, the questions will come here. Okay. So how the question will arise here? That is which drug we have to avoid in the viral infections in the children's. That is the aspirin we have to avoid in the viral infection in the children's. Very importantly, the questions will come. Okay. So if you are giving the aspirin to the child who is having the recent history of the viral infection, so that situations there is autoantibody induced liver damage and autoantibody induced brain damage will be there. So this particular situation we will call the Reye syndrome. Again, this one will be the 10-star topic and question for you all. Okay, so very, very important, right? So here is the next question, and important question again. Yes, that is a 45-year-old patient undergoing the chemotherapy for breast cancer is experiencing the nausea and vomiting following the treatment. Okay, so the oncologist decided to prescribe the medication to prevent the chemotherapy induced nausea and vomiting. So, which of the following is drug to be considered as the first line treatment in acute chemotherapy induced vomiting? Okay, so we can say the drug of choice in the treatment of the chemotherapy induced vomiting. So, which among the following is the drug of choice to treat the chemotherapy induced vomiting? Yes, that is the ondansetron. Correct answer. Okay, so ondansetron, or we can say in the clinical setting, we can say this one is in the MSET injection. MSET. Injection MSET is the, or the injection ondansetron is the drug of choice to prevent the chemotherapy induced vomiting. In yesterday only, I have told you, so the most common complication, the most common side effect of the chemotherapy is the nausea and vomiting, and the most common side effect of the radiation therapy is the fatigue. Okay, so to prevent this side effect, nausea and vomiting in the chemotherapy induced nausea and vomiting, the drug of choice will be the ondansetron. The question will come in your exam very, very importantly. Okay, so we have discussed already regarding the levodopa and carbidopa. Allopurinol is the drug. So this is the xanthine oxidase inhibitor. Okay, so used in the treatment of the, yes, allopurinol is used in the treatment of the gouty arthritis, right? So this is the xanthine oxidase enzyme inhibitors, which prevents the conversion of the proteins to the purine. Okay, so there is increased purine, so it increased the risk of the, yes, uric acid. So increased uric acid means, yes, the purine will, how allopurinol will work. Very importantly, one time the question came on the allopurinol. So that is, so whenever the patient will eat some red meat or drinks some alcohol, so there is increase in the production of the purine. Okay, so this purine get converts into the uric acid. When this uric acid will increases in the our body, so it will get deposits in the joints. Okay, it will get deposits in between the toes, joints of the toes. So, and in small joints it will get deposits. So that is what we call it, irritates and it makes the joints to get inflammation. So that is what we call as the gouty arthritis. Okay, that is what we call as the gout arthritis, right? So don't increase the purine, don't increase the uric acid. Okay, so means avoid the red meat, avoid the wines, avoid the chocolate. Okay, that is having the purine. One thing, and give the, here there is xanthine oxidase enzyme. Okay, this xanthine oxidase which converts the purine to uric acid. So block this xanthine oxidase here. Okay, so the purine will not get converted into the uric acid. Means it is treated of the gouty arthritis. No uric acid means it will not deposit here. It is not depositing here means no gouty arthritis. So that is the drug related to allopurinol. They will ask in your exam very, very importantly. Okay. So this is all about the today's class. We have discussed the most of the important questions from the pharmacology with a different concept. We have discussed the Reye syndrome also. Okay, we have discussed the blue man syndrome. We have discussed the like warfarin induced micro, what we can say, that is the micro. The word is not coming to mind. Okay, so that is the microembolic, and we have discussed the many questions like in detail with clear concept in the today's class. So in the tomorrow's class will be also like this only. So if anyone watching this master nursing classes first time, so don't forget to hit the like button and don't forget to subscribe to the channel. Okay, so do subscribe to the channel for the more important and further content. So I will come up with the more important content that may strikes in your exams. But I am discussing the those concept only that is very important for your exams, right? So and who all are watching the first time, so I am already explained related to the CRE same pattern exam. In the CRE same pattern exam, we are exposing the students to the same situations where they wants to give the exams like that in the exam center. Okay, so here will be the 5 sections of the 18 question. So 5 sections of the 20 question for the 18 minutes. So same situations. So there is no switch between the situations. You have to give the complete the 20 question within the 18 minutes. If you have completed the questions within the 18 minutes, so then consider you have completed the question within 12 minutes. You have to wait for 6 minutes. I have told what to do between that 6 minutes. Keep your last minute revision notebook and revise. Don't waste the time because this is the golden time which decides your rank. Okay, so we'll meet in the next class again with some important questions and some important concept from the pharmacology, so that may help for your upcoming exams. So tab tak ke liye stay connected and stay tuned with the master nursing classes. So don't fear, your master is here. Jai Hind, Jai Bharat.